Here's another question that sometimes people get really worried about is when they're breastfeeding and then mom gets sick. People ask me all the time, should I still be breastfeeding if I have the flu or if I'm sick or on antibiotics? And so the answer is almost undoubtedly yes. Parents get really worried most of the time because they feel like if they're sick and they're breastfeeding and the baby's just right there so close to them, are they going to be making their baby sick, either by proximity or through the breast milk? And the answer is no. To be real honest, whatever germs you already have, probably in the air, and the baby's already been exposed to them. To be perfectly blunt, honestly, and I'm pretty blunt. What's really important about continuing to breastfeed is one, breast milk is just the best food for babies, and your breast milk is the best food for your baby. Breast milk has all the antibodies in it, and so all of the antibodies that your own body is making to fight off the flu or whatever cough and cold virus you have, those antibodies are also getting transmitted through your breast milk to the baby. So at least hopefully then the baby can get the benefits of those antibodies as well. So the answer is yes, please breastfeed. Now, as a follow-up to that question, if you are sick and your doctor puts you on any kind of medications when you're sick, if it's antibiotics or other things, always make sure you tell your doctor, I am breastfeeding, is this safe? And if they say, oh no, you better just stop breastfeeding, that is not an acceptable answer, okay? Because there are many different drugs for most conditions, and there should be some drug within that category for you as an adult that should be safe with breastfeeding. If you're not sure, especially if you're at an urgent care or an ER and it may not be somebody that really knows you well or is going to take the time to really care about you and your baby, call us immediately the next business day and we will tell you if it really truly is unsafe to be breastfeeding or not. That really rarely ever happens. Now, it's very different if this is going to be some chronic medication for high blood pressure or another chronic illness that you have. I need your doctor to take the best care of you, and then we can have a very long discussion about if breastfeeding is still in the best interest of your health and your baby. But for little things like antibiotics, coughs, and colds, most things should be safe, but ask whoever's prescribing your medication to look it up. It's pretty simple. Now, I will say, when you do get sick, if you do take over-the-counter cough and cold medicines, many of the decongestants, things like Sudafed, can sort of temporarily dry up your milk supply. So please be cautious. Most normal antihistamines alone, like Zyrtec or Claritin, are really fine and safe and compatible with breastfeeding. If you're not sure about your specific drugs, just call the office and we are happy to look it up and make sure for your specific case and your baby that it will be safe. But please, please don't stop breastfeeding.